It's a controversial practice. Children's aid societies notifying hospitals when they believe a newborn may need protection. But now the Ontario government is eliminating birth alerts. It's a practice many feel disproportionately affects Indigenous and Black families.
When you give birth to a child, it should be time for celebration, time for joy.
But for some mothers who are deemed high risk, the birth of child triggers notifications between hospitals and children's aid societies.
These birth alerts immediately place the family at crisis, place them at risk. Instead of providing that support that they need, instead of judging them on whether or not their ability to be parents or to be mothers automatically becomes the decision factor whether or not they get to keep their child or not.
Last year, the Ontario Native Women's Association prevented 400 children from being apprehended by child welfare. Surette says the alert also stops many mothers from getting the help they may need.
Prenatal moms don't want to even go to the hospital for help or support, or don't want to tell anybody about their pregnancy because they're scared to let people know and to celebrate their pregnancy because people are scared of the birth alert.
These birth alerts have never been required under provincial legislation and have been used inconsistently across the province. But some are concerned about stopping them altogether.
But there are circumstances where there are risks that are not seen, right? I'm thinking of the young mother who is living in a home where domestic violence is present. And we know that that risk needs to be mitigated if a child is going to come into that home. I'm thinking of the young mom who may be struggling with substance abuse issues or some mental health challenges that aren't visible.
Instead of a duty to report, we have to look at a duty to refer and ask the mother what they need.
The Ontario Association of Children's Aid Societies say they are working closely with the province on a new system. The focus will be on a pre- and postnatal plan to ensure more families stay together.
We will have to be working closer with our communities, be able to have wraparound supports for women in a prenatal fashion, and as well as support them through that process of if there are protection concerns, how do we engage them along with public health and a number of grassroots agencies in supporting them once they get home.
Birth alerts have stopped in both BC and Manitoba, and they will end here in Ontario as of October 15th.